COVID-19 is a significant global pandemic issue and has been running since the end of 2019 when it was first discovered in Wuhan in China. Now, this has ravaged the world, and there are some serious considerations to be made when planning any sort of school excursion or activity around the impact that this may have on one of your programs. The way in which you should be treating COVID-19 is the same way that you should be treating any other highly infectious disease for either your campus or school activity. So it shouldn't be done in isolation as a separate issue. It should be done in conjunction with your other risk management considerations and concerns. What's really important, though, is that the focus on COVID-19 shouldn't detract from the other risk management principles and practices you have in place to manage risk for whatever the excursion or activity is. If the management of COVID-19 were to compromise the management of risk in another area, then it's critically important that you review the appropriateness of doing that activity at this point in time. The safety of one activity shouldn't be compromised by the implications of another. And for an example of this, I can imagine doing a belayed climb. You may have an instructor who is up close to one of the students or several students where they have to check harnesses, and then you're belaying on a rope. Now, this can be done safely, and you can apply control measures such as face masks and also social distancing. However, where that social distancing is not possible, then maybe it's worth reconsidering the activity itself until later down the track. But critically important, just as a reminder, don't compromise any of the other safety of your activities for the management of COVID-19. Now, that's not to say don't manage COVID-19. I think I really need to make a clear distinction there. But if the risks are too great for that activity as a result of having to manage another contingency and another hazard, then discontinue that activity at this point in time. I think that's really the most important outtake from this. It is really important to expect that all of your instructors are up to speed with what the virus is, how it is transmitted, and control measures. It's really important to provide this information to the school administrators, the teachers involved, the parents, and the students. And clear communication is critically important. Just because it's been on the news every single day for the last 8 months or 12 months or however long it's been, it's really important that you still go through the causation and the control measures and be very clear with staff about this. It's really important that prevention is absolutely critical to the safe running of your programs. As an indication of some of the different levels of risks you may encounter and how to manage them, we'll just run through some of the high and medium level risks where you may need to look at other personal protective equipment and other controls to be in place for this kind of activity. For example, an instructor providing first aid to a student, generally you would have your standard, and absolutely you would have your standard of gloves on to handle any patients. But in addition to that, you should also look at having face masks on both parties and ensuring that if you can't maintain that social distancing of around 6 feet, then you must have those personal protective equipment and devices in place to prevent that or reduce the risk of that transmission. So that's one of the high risk activities, is applying first aid. Also, if you have teachers or teaching assistants who are working with higher needs students, say if you have students with disabilities or any other provisions where they need a carer and the carer may be in close contact, again, this is where that personal protective equipment is critically important, as these would be considered a high risk activity in the scheme of things in the current environment. In terms of some of your medium risk activities, all of those instructors and students and staff on any of the trips should be considered a medium risk. So as this medium risk may involve handling cutlery, handling dishes, also being on vehicles or in vehicles together, then you really need to consider the cleaning regimes and the monitoring of this as a critically important part. What we've done is we've put together a document which steps you through these different contingency plans to help guide your approach to getting school excursions back out and running again. This online guide is to be used in conjunction with the latest recommendations from the CDC, as well as the recommendations from your school administration, their legal counsel, and their insurers. So please ensure that you cover all of these different bases, because the most important thing is to safely get our students back out and doing the sorts of school excursions and activities and camps which they love and they learn so much from. So it's really important, as an additional consideration to your risk assessments at this point in time, and certainly for the foreseeable future, to be really focusing on how are you going to effectively prevent the virus coming onto your program, and if so, if a case does occur on the program or a suspected case, how are you going to quickly isolate that student or that staff member or that instructor, and then make contact with authorities to let them know so contact tracing can start to prevent the wider spread of the disease.